I appreciate all of you taking a half an hour out of your lives during Christmas shopping season to come to my talk and learn some things about your health. So, as you know, part of the reason I do this is I just want to educate our community to get healthier so they take less pharmaceuticals. And we know that for a lot of people, when they're on 4 or 5 pharmaceuticals, that can be the equivalent of, you know, drinking a couple of cans of beer, and they've shown that in research. So if we can get people to decrease the amount of pharmaceuticals they're taking, we're going to live in a safer, healthier culture. So the word inflammation, anybody remember the first time they heard that, or when they started hearing that term?
Maybe 5-10 years ago?
Yeah, it's been fairly recent. Okay, so when I was in chiropractic college back in the 70s, late 70s, the only place we really studied inflammation was in Boyd's Pathology. It was this huge pathology textbook that medical students studied from. We read it, we studied from it, and they talked a lot about inflammation in there. Otherwise, you didn't really hear that much about it. It was kind of like, almost like autism. You never heard the word, you know, autism. You never heard the word Alzheimer's back in the late 70s and 80s, and I talked about that last week during my talk on Alzheimer's. You didn't hear the word inflammation either, okay? And so now inflammation is one of the biggest bywords in our culture. You hear it all the time. So what do you hear about inflammation? What have you heard about it? What have you heard about the word, how it's used in health? Anybody?
I hear about joints.
Yeah.
Could be from food related to sports injury or work injury or anything like that.
Yeah, okay. Injuries for sure. Yeah, okay. Anybody else? So have you ever heard the term that, or the phrase that inflammation is the cornerstone of all disease? You ever heard that?
I have.
Yeah, I have. I hear it all the time. And it is, it's true. Anytime you have pain, you have inflammation. Anytime you have pain in your body, you've got inflammation. Now, can you have inflammation without pain? Yeah, you can. We're going to talk about how that works here. You can have silent inflammation, which over time can really affect your health in a very negative way. But you cannot have pain without inflammation. So if you got pain, you got some inflammatory something going on in your body. So let's is this going to work for me?
Hope so.
Well, doesn't seem to be. Hold on just a second here. Here we go. Okay, here we go. Now we should get it. Okay, so inflammation is part of a complex process in your body, your body's response to harmful stimuli. Okay, it could be an infection, could be cells that are damaged, like, you know, if you hit your thumb with a hammer, you're going to damage some cells. It could be pathogens, it could be irritants, toxic chemicals, or food intolerances. And some of the themes that you're going to hear from me tonight, that if you've been in several of my classes, you're going to hear these again. So inflammation is a protective response that involves immune cells, blood cells, and what we call molecular mediators. So anybody ever had a sprained ankle besides me? No?
Oh, yeah.
Okay, what happened?
Swelled up big time.
You got inflammation.
Yeah.
Yeah. Yeah, so why does the body do that? Why does it give you inflammation?
heal.
Yeah, it initiates a healing process. Good answer. What else does it do? Why does it swell it up when you get hurt? How about it's trying to protect it from getting injured further? That's another aspect of inflammation. Your body's trying to protect itself so the part of the body doesn't get injured any further. So the purpose of inflammation is to eliminate the initial cause of cell injury, clear out dead cells and tissues, damaged cells, to initiate repair, like you said. When inflammation occurs, chemicals from the body's white blood cells are released into the blood or affected tissues to protect your body from foreign substances. So what lifestyle factors cause inflammation? Okay, stress. Okay. Does anybody know how stress causes inflammation? Prolonged stress. Now, very short-term stress, no, but prolonged stress.
Does it release a chemical?
Which chemical? It's a good answer so far.
It would be adrenaline, would it?
Close. You're in the right gland, wrong chemical. Well, adrenaline's one of them, yeah. Cortisol.
Oh, okay.
So it releases cortisol. Cortisol goes up. Now, cortisol in short term decreases inflammation, but in the long term, what does it do?
Causes and creates and allows it to stay.
Well, it mobilizes sugar in your body, and it helps create sugar, which your body needs for energy, and sugar raises insulin, and insulin creates inflammation. That's how it works. Diet, sugar, lots of things in our diet cause inflammation. We'll talk about that in just a minute. Smoking, huge cause of inflammation. And sleep deprivation, not getting enough sleep, aka college. Okay, so at least it was when I was in college. So what are the chronic inflammatory syndromes? Number one is obesity, huge cause of inflammation. If you're overweight, you're carrying inflammation, period. Arthritis, fibromyalgia, which is muscular inflammation, atherosclerosis, which is inflammation of the arteries, type 2 diabetes, any autoimmune condition is an inflammatory condition. And then there's GI inflammation, which is leaky gut, and cancer. Cancer is an inflammatory disease. So why is our diet so important? So here's some interesting facts. Every 5 months you get a new liver. Your liver turns over every 5 months, okay? We get new skin every month. We get a new stomach lining every 4 days. Lung tissue turns over every 2 to 3 weeks. So can we make healthy cells, tissues, and organs from junk food? No. Cannot do it, okay? Can't do it, okay? So if you're eating a lousy diet, you cannot make healthy cells to replace these cells. So what do? You basically make organs that don't function as well, that are unhealthy. Okay, so let's talk about foods that cause inflammation. Talk about sugar and grain, especially refined wheat products will cause inflammation in most people, okay? And we're in the inflammatory season right now, okay? Like Christmas, the Christmas holidays. I mean, I go to Costco and I look at the amount of alcohol people put in their carts, and I go, how do you do that? You know, why do you do that? So these sugar and grains they raise insulin levels, they increase insulin, the insulin increases the production of pro-inflammatory chemicals in the body. Insulin is also a fat storage hormone. You've heard me say that before. So insulin helps fat get into the cells, then it locks it in there, and it won't let it out unless you lower it. Sugar has a very similar chemical makeup to vitamin C, and it competes with vitamin C to enter the cell. So why is that bad? What's wrong with that?
Because you're not getting any of the nutrition you need to get.
Yeah.
The sugar's pushing it out.
Yeah, so vitamin C is really important for your immune system. So if you're eating sugar and that's what's getting into the cells instead of vitamin C, what's that going to do to your immunity? Going to crash it. Yeah, that's what happens during the Christmas holidays. That's why everybody gets the flu in January and February. Elevated insulin decreases the cellular uptake of magnesium, resulting in increased blood pressure and muscle spasms. Here's the additional effects of insulin. It causes an increase in risk of cancer. It ages you more rapidly. Elevated insulin causes the body to dump calcium into the urine, increasing the chances of osteoporosis. So this is all because, you know, you're eating too much sugar. So your insulin keeps spiking. Your magnesium and calcium get dumped into your urine, okay? So that's when it's a lot easier for people to get muscle spasms and decreased bone density over time. By the way, just out of curiosity, what's the other factor in decreased bone density that's really important other than calcium?
Vitamin D.
Vitamin D is important, but there's something else. Vitamin D is yeah, it's really important, but it's protein and essential amino acids. If you don't have that, you cannot make bone, and your bones will deteriorate. I'm going to do a talk on that in February. In men, elevated insulin hastens the conversion of estrogen to estrogen, increasing weight gain, lowering energy and sex drive, and contributing to depression. So, you ever seen these overweight men with kind of man boobs? You know, too much insulin, okay? They're converting their testosterone to estrogen. It's not good. Turns men into women, basically. High intensity aerobic exercise and weightlifting lower insulin levels, along with wise dietary habits. So if you really want to reset insulin, do high intensity training and weightlifting. Okay, now the second thing, this was diet. Second thing is fatty acid imbalances. Fatty acid imbalances cause inflammation. So what are the fats that we should not eat?
Processed fats.
Yes. Mm-hmm. Processed omega-6 processed fats, exactly. Causes silent inflammation in the body. So these fatty acid imbalances between omega-6 and omega-3 causes the silent inflammation. So these are the vegetable oils you want to completely avoid on the aisle of the store. And you never want to get any of that, unless you're trying to poison some people over long term, but you never want to get any of that. One of the best tests for measuring silent inflammation is what's called the AA arachidonic acid to EPA ratio. And this is a really accurate way of looking at, do you carry silent inflammation, which is degenerating cells in the body? This is just a fatty acid test. It's a finger stick test that you can do, send it in, and it gives you very, very good information on what your fatty acid situation is in your body. So eating trans fats causes inflammation, which is all your processed food and a lot of your fast food. We know that margarine is high, very high in trans fats. So what are signs of essential fatty acid imbalance? Well, inflammation. Anybody consuming the standard American diet has fatty acid imbalances. Dry, flaky, scaly skin. Dandruff, dry hair dandruff. Mental and emotional issues can be fatty acid imbalances, not enough DHA in your brain. So decreased memory, psychological problems, depression. We're going to talk about that, more about that in a minute. Decreased immune response, people that easily get sick. You know, anybody know people like that? They're just sick all the time. Yeah. Fatty acid imbalances. They've got they're just not getting enough essential vitamins and minerals. Too much sugar in their diet. Increased cholesterol and serum lipids is a sign of essential fatty acid imbalance. So subluxations, which chiropractors treat, which I treat every time I adjust you, is another source of inflammation, and that can cause pain, or you can have subluxations and have no pain for a long time. Come into me and what is this? What happens when you get an inflammatory response around a joint that just sticks around for a long period of time? What happens?
Get your spine out of from its correct line.
It will. What else will it do?
Pain.
What?
Pain.
You can, but there's a lot of people that carry around inflammation in their spine that have no pain. What does that do?
Deteriorate the cartilage?
Good answer. Yes. Inflammation causes arthritic deterioration of the joint over time. That's exactly what happens. And you may not even know it. I mean, I have people that come in all the time that have that may not have pain in certain areas of their back, and they have all kinds of arthritis in there. It's silent inflammation. It causes destruction of the vertebral motor unit. So abnormal mucosal barrier, leaky gut syndrome, is a huge cause of widespread inflammation in the body. One of the biggest causes in our culture, and it's caused by food intolerances, and we'll talk a little bit more about what causes that in a minute. But I want to show you an article, really interesting article. This is written by a guy by the name of Alessio Fasano, an Italian. He's the head of mucosal immunology at Harvard Medical School. He teaches at Harvard Medical School. And he wrote this article called "All Disease Begins in the Leaky Gut. Role of zonulin-mediated gut permeability in the pathogenesis of some chronic inflammatory diseases." And basically what he says many, many, many diseases that people have are due to a result of inflammation in the gut causing leaky gut. And he lists a whole slew of diseases here that I'm not going to read them all, but you know, aging, autism, ADHD, celiac disease, irritable bowel, chronic fatigue, colitis, major depressive disorders, multiple sclerosis, non-alcoholic fatty liver disease, schizophrenia, type 1, type 2 diabetes. You ever hear about this stuff being caused by a leaky gut?
No.
You never hear about that. But here's a guy from Harvard writing it in a major journal, okay, talking about it. This is what leaky gut looks like. The cell lining in the gut, in the small and large intestine starts to come apart, and things leak through there that shouldn't leak through. And when this gets really bad, what happens, and I see this on the leaky gut test that I do, is you get what's called lipopolysaccharides, which are toxic bacterial end products that get through this into the bloodstream. Now I was talking to a woman today from the lab that I use, and she told me something very interesting. She's read some research recently that shows that when lipopolysaccharides get into the gut, through the gut and into the bloodstream, in a woman, they'll cause ovarian inflammation, a decrease in ovarian function, and lowered progesterone levels. So what does that do to a woman's chances of having a baby? They go way down, okay? So it becomes a fertility issue. I have a patient with that issue right now who's 21 years old. And guess what? I did this test on her. Huge amounts of lipopolysaccharides they found in her blood, okay? So what causes leaky gut? Food intolerances, wheat and gluten, the biggest offender, dairy, sugar and flour, and then some people are intolerant to corn, soy, plant lectins is another one. Excessive alcohol, people that, like the guys that I see filling their shopping carts up with alcohol at Costco, you know, they're going to give themselves some leaky gut. Many food additives. And I heard a doctor, I'm reading a book by Dr. Minkoff right now on protein, and he said, and I heard him say this in a talk that he gave, all drugs, all pharmaceuticals cause leaky gut. He didn't say some, he said all. But the biggest offenders are things like antibiotics, non-steroidal, you know, over-the-counter aspirin, ibuprofen, acetaminophen, birth control pills, steroids, chemotherapeutic drugs, and antacids. Huge offenders when it comes to leaky gut. So here's what I've said. Here's my theory, at least. You know, I grew up I went to high school and college in the 60s and 70s, started practicing in the 80s, and I am convinced that the wholesale prescribing of antibiotics during that time is what's causing all the autoimmune issues that people have now. It's one of the big causes of it. Because back in the 60s and 70s and 80s, when nobody knew that the antibiotics were sterilizing people's guts and causing leaky gut. Nobody knew that. Nobody even suspected it. And I think that's one of the reasons for all the autoimmune issues that we have now, is all these pharmaceuticals that were given to people then that nobody knew how they were affecting their gut. Nobody even thought about it. And now we're reaping the effects of that. So additional causes of leaky gut: parasites, yeast, environmental toxins. I've talked about that almost ad nauseum in my talk. Long-term stress, nutritional deficiencies, low zinc, which is really common. Low stomach acid is also very common. So here's some signs that you might have leaky gut, okay? So if you have gas, bloating, diarrhea, irritable bowel syndrome, you might want to look into that. Seasonal allergies or asthma, hormonal imbalances such as PMS or PCOS. If you have any autoimmune disease, you're almost assured to have leaky gut. And you know, some of them are Hashimoto's, rheumatoid, lupus, psoriasis, celiac. Most systems in your body, most diseases that people get are downstream from your gut. So, if you have diagnosis of chronic fatigue, mood and mind issues such as depression and anxiety, skin issues, if you know people who have rosacea, you know, big red cheeks, you know, that's an autoimmune issue. Eczema, candida overgrowth, anybody that has food allergies or food intolerances. So how do you know for sure if you have leaky gut? The Wheat-Zoomer test is my favorite. It is a great test. It'll show you, do you have leaky gut, and are you intolerant to any aspect of wheat, not just the wheat gliadin, but any aspect. It's a great test. So here's one of the things that the Wheat-Zoomer tests for. It tests for this thing called transglutaminases. They're enzymes that bind proteins together that are involved in the digestion of wheat. So transglutaminase 2 will eventually, if you have that, give you an autoimmune disease of the GI tract. Number 3, an autoimmune disease of the skin. And number 6, autoimmune disease of the central nervous system or brain, spinal cord. So, you know, wheat can cause a lot of problems in the body. How do you correct it? You get rid of the foods that are causing it. You get rid of the medications that may be causing it. You know, you kill off yeast parasites and repair your gut with specific formulas. So now I want to look at inflammation as an underlying cause of depression and Alzheimer's. Now, we talked about Alzheimer's last week, but a lot of people are depressed because they're inflamed. And the literature shows this. It's called a brain on fire. And at the root of it, you know, you have these microglial cells in the brain, which they're the immune cells of the brain. And they determine whether your brain is inflamed or it ages too quickly. And so one of the biggest risks to overacting the microglia is a leaky blood-brain barrier. So the blood-brain barrier is very vulnerable to aspects of modern life. So let's look at what are the causes: chronic stress, alcohol consumption, elevated blood sugar, diabetes, vitamin B vitamin deficiency, chronic environmental toxic exposure. And last week I talked about the patient that I'm seeing right now. He's from out of town. He had chronic exposure to pesticides and gasoline fumes. It showed up in his tox screen, and there's very, very high levels of it. And we got to get rid of that if he's going to get better. We've got to detoxify him. And he works as a machinist, so he works in an environment where he's exposed to a lot of that stuff. Previous head trauma, lack of oxygen from poor circulation, eating too much gluten, dietary gluten, low brain antioxidant status. So what would be like in your diet, something you could eat that would increase your brain's antioxidant status? What's something you could do?
Fish, omega-3s.
Fish would be good. Omega-3 fish, type fish, that's right, that's one.
Nuts.
Nuts, good, yeah. Anything else? How about berries? Anybody ever heard of blueberries? Blueberries, raspberries, very high. Yeah. So I put blueberries in my salad every day. Every time I eat a salad, blueberries go in it, okay? So I'm trying to increase the antioxidant status of my whole body, especially my brain. Okay, symptoms of neuroinflammation can be brain fog, depression, unclear thoughts, your inability to concentrate and study. And that pretty much includes all of that. Okay, this is in JMA Psychiatry, October 2014. So this is a Blue Blood Medical Journal. It said elevated levels of C-reactive protein, a biomarker commonly used to assess inflammation, may be associated with an increased risk for depression, new research suggests. I do this test as part of my comprehensive blood panel, and I see elevated CRP all the time. I mean, I see it really high in some people. So it's a very easy test to do, and it basically tells you what the inflammatory levels are in your body. Current literature lends further support to the view that major depression is associated with a pro-inflammatory response as indexed by elevation in C-reactive protein and cytokines such as interleukin-6 and tumor necrosis factor alpha. That's in Current Opinions of Psychiatry 2009. So here's these psychiatric journals saying that really, if somebody comes into your office and they're depressed and they have a high level of CRP, that inflammation might be the reason. So how do we test for blood-brain barrier disruption and brain inflammation, autoimmune issues in the brain? Neurozoomer test is the gold standard. That's the one I use. Very, very powerful test. You can do the CRP. That'll tell you have inflammation. It'll tell you what's causing it. But this test will really reveal a lot of causes. And I talked about a lot more about this last week. So how do we reduce inflammation? Okay. Eat a whole food diet, okay, including lots of, we just talked about nuts, fruits, vegetables, and keeping this stuff to a minimum. I'm not saying you can never not have a dessert. I mean, if I ever said that, nobody would follow that advice. I mean, everybody's going to eat some dessert at some time. Avoid exposure to toxic metals. Test and repair for leaky gut, and get 7 to 8 hours of good sleep and regular exercise. So, I mean, if you just did number one, you did the best you could with number two, get regular sleep, good sleep, regular exercise, you do a whole lot to avoid just by doing that, leaky gut, a lot to avoid it. Unfortunately, this does not happen a lot in our culture, at least in my experience, it isn't. I mean, people that do this, that exercise regularly and eat a really good diet are in a very low percentage of our population. At least that's what I've noticed in practice. So if you just did that, and if you actually tested for leaky gut and then did some things to repair it, that would even be going beyond that. So here's some nutrients that can help. Silymarin, turmeric, ginger, boswellia, slippery elm, gotu kola can all help with leaky gut. Fish oil, resveratrol, green tea is really good, really helpful for repairing leaky gut. So I drink, in the wintertime especially, I drink green tea every day, every single day. Come in with green tea. So who do you know that has problems with inflammation, has health issues, has depression and anxiety and issues with function in their body? Maybe we can help them. At least let them know, what can help them, as far as things I've taught you tonight, showed you. And we'd be happy to talk to them about any of their health issues and steer them at least in the right direction. Like I've told some of my patients, if you have brain fog, and I think you were talking about this last week, get rid of dairy, sugar, and gluten in your diet. And I've had patients do that, and it really helps. Just doing that. It's free. You don't even have to come into my office, okay? Just do that. And if that doesn't work, we may need to do some other things. So, any questions about anything I've gone over tonight?
What's in dairy products that's an issue with this?
Casein. Casein is highly allergenic. Highly allergenic. It's in milk. And it's
that
not
casein protein?
Casein protein, right. It's not good.
When you talk a lot about wheat and gluten, is that highly processed wheat and gluten? So like, let's say you can get your hands on old-fashioned red wheat flour and make your own bread.
That hasn't been hybridized and sprayed.
Mm-hmm.
It might work. There's wheat over in, the Europeans use a different kind of wheat than we do. And in other countries they do. And so that, that may be not as harmful as what we use here. It's like my mother said, my 93-year-old mother told me when I was there in October, she said, the flour that we have now is not the same flour we had when I was growing up. She said, I don't know what they did to it, but it's not the same. Yes?
I switched to brown rice pasta years and years and years ago, and there's certain brands that are better than other brands. That's what I use.
Yeah, that works great.
For me.
Yeah.
So.
Where do you get it?
Actually, the brand I buy is at Natural Grocers. Hy-Vee has the brand. So they make spaghetti. They make it in the shell.
So you make it out of brown rice flour, basically.
They make it out of brown rice flour.
Yeah, awesome. good. So if you don't have an intolerance to rice,
So far, I
yeah,
don't.
you're good. You're good to go. Right.
Who knows?
I know.
It didn't show up on the test we did, so.
Yeah, good.
So that leads me to a question, these various tests you talk about, is that something you offer here for the blood work and the testing?
Mhm.
It is?
Yeah.
Is that done in-house, then you send it out?
Yep, yeah, we do it. We draw it here, send it out. And in fact, I just found out today, I didn't even know this, but you can do the weed zoomer test and the neural zoomer test with a finger stick on a card. I didn't know that. I just talked to the lab, the lady who represents the lab today, and I knew I could do that with other labs. I didn't know I could do it with them. So if you're a really hard stick, that's the way to go. And I'm pretty good at drawing blood, but sometimes I can't even get it. Yes.
Okay, does the intestine renew itself after so many months, or like for the leaky gut? As you were talking about, the liver renews itself, we have all new cells. Does the
GI tract.
GI tract,
Absolutely it does.
how long?
I don't know right now. I have to look it up.
Please.
Okay. I didn't have that in my slides.
All right, I know.
Yeah. Thanks for asking.
I wanna know sometimes.
Okay. So if you're feeding yourself things that your body's intolerant to, it can't renew.
Won't heal.
Will not heal.
Right.
Just can't. Yeah. Even if you're taking things that will heal your gut, if you're eating the things that are hurting it, it's not gonna work. So, anybody else? Any other questions? Okay. Clear as mud.
Yeah.
All right. Good.
Thank you.
I think we're good. Yeah. Thanks for coming tonight. And my next talk is in 3 weeks.